Uh, I'm going to talk about a case that shows the benefit of intravascular contrast agent utility in MR angiogram of the head and MR angiogram of the neck. This patient was referred for questionable occlusion of the left side vertebral artery. So this is an MR angiogram from 3T that showed the right side vertebral artery normal flow, and the left side vertebral artery, only the most upper part of the vertebral artery is have blood flow, and then which the posterior inferior cerebral artery originate from this distal left vertebral artery. The rest of the left vertebral artery, you don't see it here on the MR, 3T MR. You don't even see it. You can see it kind of a small vertebral artery here. After getting to the intracranial portion, you don't see the blood flow anymore. So the question is that a retrograde flow that represent a vertebral, represent a subclavian steel artery, a subclavian steel phenomenon, or occlusion, or clotted, or trickle flow? That would make a difference. A patient had a symptom of vertigo. This is the MR angiogram from 3T. By the way, the basilar artery also demonstrates a focal area of lack of blood flow. Maybe because of the pressure from the right vertebral artery is not powerful enough to overcome this area to supply the tip of the basilar artery. Patient has fetal origin and patent bilateral posterior communicating artery, so maybe they are supplying the posterior circulation above the mid-basilar artery. So now we can talk about the utility of the intravascular agent in generating a high-resolution MR angiogram of the neck. On the left side is traditional 2D time-of-flight MR angiogram axial images, which you can see there is a normal common carotid artery. The right side vertebral artery is larger than the left. The left side is diminished, but it's still there's blood flow. But in the intracranial portion, you just don't see the vessel at all. So you cannot tell the difference between occlusion versus trickle flow. However, on the left side of our screen is a high resolution images obtained with this intravascular contrast agent that we can acquire in one slab and reformat into coronal, sagittal, and axial images. This is axial images. It is not approved for the carotid artery yet. It's approved for renal artery, but anyways, it demonstrated all the vessels very well, consistently in pretty much all the patients I have seen. The artery, the common carotid artery, the jugular vein, the right vertebral artery, the left vertebral artery, very tiny one, surrounded by a circle of vein. So you can follow the left vertebral artery, follow the tip of my mouse. You can follow it, and from that dot, you're gonna see a where is here this kind of reverse C-shaped vessel. That's a vertebral artery, which is right here. So you can even see it very small, or less than 1 millimeter. You can see this vertebral artery has contrast filling it, even in the intracranial portion. And then after the vertebral artery have junction with the pica, it's more obvious to see the pica, and distal vertebral artery, probably from the contralateral blood flow. But still, I proved this vessel is not occluded. I still demonstrate contrast within it, versus on this side you just don't know, or you cannot rule out occlusion. This is to show you the regular MR angiogram, contrast-enhanced MR angiogram of the neck, still show a small vert on the left side, but still the area of concern you don't see it well. The resolution is not high enough for you to confidently identify whether this is occlusion or very stenotic portion or very small vessel. Again, this is MR angiogram of Circle Willis. You don't even see any flow there at all. The problem is only solved by this super high resolution contrast enhanced MR angiogram with this intravascular agent. Look at here. This is a vascular artery. Bifurcate the right vertebral, left vertebral. The left vertebral have pica takeoff right here, and then continue on with contrast into the cervical region, and you can follow it, this vessel, down in a high resolution format, so it's more convincing than the other one. So this case is a congenitally small left vertebral artery that does not have the power to pump all the way to the pica. So the pica was filled through the contralateral side, but the left side was still supplying something. It's not occluded, and demonstrate the utility of this intravascular agent.